My name is Gaurav Agarwal. I'm the Managing Director of IITPL. We are a Cath lab manufacturing company based out of Bangalore. We were incepted in 2016, and in the last 4 years, we've gone on to become the fastest growing and the most awarded Cath lab company of India. We were also the Medical Device Company of the Year by Department of Pharmaceutical last year. Also awarded the President's Award for Innovation, among many other awards such as Red Dot Award by the Swiss government and Good Design Award by the Japanese government. It is interesting to note that less than 200 of these cities have facility like a Cath lab. A Cath lab truly saves lives. You have a heart attack, you need a Cath lab to save a life. There are medical treatments available, but 3/4 of the time patients are unable to make it. Now at IITPL, we've recognized that this is a huge gap area, and medical electronics, an area that we represent, constitutes nearly 65% of India's 42,000 crore import bill. So we are we are making a small contribution to make especially heart care more accessible and affordable to a larger segment of the society. Having said that, since the topic of today is also connected and digital economy, we are not only making heart care more accessible, but we're also creating Cath labs of the future, which are largely based on 3 principles of digitalization. First is interoperability. We are trying to create an integrated network of diagnostic modalities where healthcare and diagnosis is seamless, making clinical outcomes more precise and more reliable. The second area where we are investing a lot of time, money, and effort is in artificial intelligence. So artificial intelligence, basically, as we know, is now creating human simulators to predict, to suggest, and also to improve and make clinical outcomes more precise. The third area which we are working on is basically remote sensing and diagnosis. Today, imagine we have a Cath lab which is 300-400 kilometers from the nearest airport, and it's a life-saving equipment. What if there's a breakdown and there is a critical patient on the table? We are developing technologies of the future where all the parts, most parts, moving parts, electrical parts, X-ray parts, and mechanical parts, generate a lot of data which can be stored on a remote diagnostic server, and most of the breakdown or service calls can be attended remotely. So I just wanted to say that we are doing our bit not only to make India Atmanirbhar, but also create Atma Samman. India is recognized as being a top-notch engineering talent pool for creating technologies. We are great at prototyping them. There are a lot of institutions of eminence that we have, some of whom I've had pleasure of working with. But prototyping to product is an entirely new journey, and sometimes the most tedious one. You know, it's easy to create a prototype that works in a very controlled environment, but the real test of the pudding is when that product is put on a patient and it's delivering consistent outcomes day after day. So in my opinion, we are in a space, medical equipment. One of the design goals for us when we set out to build a Cath lab, there were only 3 goals. First goal was to have the smallest footprint. You know, that came across as a very strange goal for many people. They said, why do you want to build a small Cath lab? I mean, Cath labs are large, bulky animals. You know, you creating something which has the smallest footprint. The second was to make it most radiation safe. We wanted to have the most radiation efficient Cath lab, which is directly linked to patient and operator safety. And the third, interestingly, was to have the most aesthetically appealing piece of medical equipment that has been built in India. Now, the perception of quality not only has to do with factor, but also form. We provided a lot of emphasis on the form. We hired some of the best industrial designers in the world, and the product went on in its very first year to win the Red Dot Award, which is also called the Grammy of Industrial Design in Switzerland. We also went on to win the most coveted Good Design Award by the Ministry of Commerce, Japan. And my message, honestly, to people in the medical electronics equipment space is that a lot of times you may not get rewarded incrementally for the form factor, but it goes a long way in creating perception of very high quality. The second part that you touched upon is customer service. The reason why we've been so successful, we are now the third largest selling cath lab in the country in less than 2 years, is because across 38 parameters of customer satisfaction, we have consistently ranked above 88%. So our customers bring us customers, and that is another area which gets impacted by your quality. If you don't get it right the first time, you'll have more breakdowns, you'll have more complaints, and that also in the long run. So data security in our field is extremely important. Patient confidentiality of medical records is something that we take extremely seriously. So we have medical grade encryption in all our data records. Our acquisition systems, our data workstations are completely 256-bit encrypted, and we ensure that data safety is at the top of all our software development. So any area which involves a patient record is treated with absolute discretion, and there is 256-bit encryption in that data. There are two initiatives that I'd like to talk about, and they also touch upon our topic of digitally delivered healthcare. So one of them is cardiology at doorsteps. If you're on LinkedIn, you would have seen Dr. Padmanabh Kamath from KMC Mangalore. He has quite a fan following on Twitter and LinkedIn. And what he's done is something very effective and very simple. He saw that in and around Mangalore, there were a lot of coastal villages where even primary health centers did not have ECG machines. Towns that had population of 20,000, 30,000, 50,000, he would see those patients end up in his hospital in vegetative state. So using various NGOs, he got an ecosystem set up of about 350 to 400 echocardiography machines at primary health centers. And those doctors were connected to a WhatsApp group of 150 dedicated cardiologists. There's a patient who comes with an acute myocardial infarction or a heart attack simply. Doctor takes an ECG, sends it to that WhatsApp group. The doctor who has geographically greatest proximity to that private health center recommends a line of treatment. He has saved over 11,000 patients since the program started. Something extremely simple but very effective. He's also the winner of the Jan Aushadhi Award recently by the Prime Minister himself. So it shows that technology may not be big bang all the time. There are times when you can use technology in a rather simplistic manner to still make healthcare delivery very effective. Another, and very quickly we're running out of time, it's a program called STEMI India, started by Dr. Thomas Alexander in KMCH Coimbatore. It has a very unique hub and spoke. There is an algorithm and there is a software that they install in the spokes. All those spokes collect a bunch of data related to the patient specific to heart disease that is transmitted to about 16 hub centers. And this has resulted in huge mobilization of patients who were so far untreated or would be undiagnosed. So programs like these are showing us that the next generation of healthcare delivery is indeed through connected, smarter, and predictive technology tools.